it has some impact and they remember it even when they go overseas. But what can we say to your cohorts? What can we say to 14, 15, 16, and 17-year-olds? Or is there anything that an adult can say that would make them reconsider? Microphone up.
It's tough because it's really new. It's a new device and nobody really knows the long-term effects. But something that worked for me was, take a look at your life and is this who you want to be? Like there was in the 60s, 70s, there was this whole generation of people that were smoking cigarettes inside and outside and in their cars and everywhere. And you just, I ask yourself who you want to be. Do you want to be dependent on something to get you through the day? And so when I was in middle school, when we had health class, we didn't talk about vaping because it was just becoming new. But now, now that it's becoming an issue, Mrs. Vendetti, she's been in the health class speaking about vaping, and I think the education in the health classes, that's a good way to start.
Dr. Wood? Did you want me to give you a question?
Yes, please.
Okay.
Can I speak to that before we move on?
It was, yeah, but just to let you know, it was, what do we say to young people and how do we get them to stop, or how do we educate parents to say the right things to young people? Jessica?
I think something that we've found with the program that we put together, Ms. Unker, Mark, and I, that works is the kids hearing it from other kids. So the more that you can involve young voices in the conversation, the better. At ABC, oftentimes a student might come in and sit around the table and say, I had a really hard weekend, I didn't know what to do, this is what happened, and it was hard for me. And they're looking to Ms. Unger, and I. And we will look around the room and say, can anyone else say how you handled that when you were 2 weeks free from Juul? We try to kick it back to the kids. When it's young people's voices, they connect better. And I think that's why we touched on something with ABC that was unique, because Mark was the driving force. And that really helped. And I try also to make sure, I think this is important, to not try to overwhelm them or scare them with horror stories, but really stick to the facts. I try to make myself that they could fact check me, that whatever I say to them, if I'm giving them a fact based on science around vaping or any other dangerous behavior, that they could go and find information. They could Google and see that, yes, Mrs. Vendetti was telling me something correct. Because the minute that you tell them something that is not 100% based in fact that science has latched onto, you lose all credibility as an adult with the teenage population.
Something you can tell them, and they can fact check it, is, and you can see it in the New England Journal of Medicine recently, it can blow up in your mouth literally and shatter your teeth and destroy your jaw. This has happened more than 2,000 times between 2015 and 2017, according to ER visits, and those are stats you can look up. That's a good one, by the way. I think that one might work.
When in the olden days, when I was in med school and when dinosaurs roamed the earth and I was trying to convince kids not to smoke, I would go for that vanity angle. It changes your nails, your breath's going to be bad, your teeth will look at, you'll get your wrinkles, because they don't, 12-year-olds don't have a 10 or 20-year plan necessarily. They don't, cancer. All right, so when I'm that big, they'll have a cure. There isn't that kind of responsibility towards the future. So sometimes I'll throw statistics at kids to try and convince them, it's almost like what you're saying, if you sound knowledgeable and there are things you can check online, and it's not something that they'll necessarily question. So teenagers who start to vape are 7 times more likely to smoke cigarettes as adults. See my fact checkers, and things like that. Listen, it took generations for us to figure out that cigarette smoking caused cancer. This is too new. We just don't know yet. But we know it's not good for you.
I want to invite our audience to, this has been a great conversation so far. These guys are awesome, but what we really need are your questions. I think that would be great. So Don't make me come out there with a microphone, I'll do it. There's our first, please, others, come and line up and we'll work you into the conversation. Yes, ma'am, in the back.
Hi, I'm Erin Godler from Progressive. I had a question for really the whole panel, maybe Jessica specifically. Where's the correlation between the increase in anxiety at this age and the increase in nicotine use? Are we statistically seeing any correlations between the mental health aspect?
That's a great question.
So we have seen a statistical increase that's significant in anxiety in our youth population in recent years. So this isn't something that we're just saying. We have the research to back it up that yes, you are correct. We have increased anxiety diagnoses amongst youth. I think that that's driven I think we can definitely sort of extrapolate how can that be connected to what's going on in relation to substance use. But I think the biggest piece of that is technology. So I just want to throw that out there. I know that's not what we're talking about, but I think it's important to bring it up. In relation to substance, there are definitely young folks who are experimenting in sort of that I'm going to take a risk, I'm going to try something, I want to look cool in front of someone else. They're experimenting with vaping products, and then they found that while they were under the influence of that vaping product, it relieved some anxiety. So then they're going to turn to that again. So we definitely have folks who are self-medicating and I think we've been talking primarily about nicotine, but marijuana, THC, is a huge concern with teen vaping. We have folks who come to ABC they're perfectly happy with their nicotine use, but they want to stop using THC, and vice versa. So THC and nicotine can take the edge off anxiety. I think the issue also becomes then, once you become addicted, and then you try to stop, like Mark described, you're going to have sort of this increase in withdrawal symptoms, and definitely in that first week, we have young people describing anxiety symptoms. So if you already have a pre-existing anxiety issue that you've struggled with, and then you become addicted to marijuana or nicotine in a vape form, and you're trying to quit, it is going to exacerbate those symptoms in that small period. So it definitely plays in, and I'm always having conversations when I'm talking with my students around changes with their substance choices about their mental health. So it's for sure connected, and we have to definitely address that. And that's why just telling them, don't do this, it's not good, doesn't work. You have to understand why, for that specific young person, what role has it come to play for them? You know, sure, it's great if we can avoid them starting in the first place, but if they are actively, regularly using, we have to figure out why it's working for them and address all of those different concerns, and absolutely mental health would be one of them.
Dr. Wilbur, is it just anecdotal, or are more young people experiencing anxiety?
It's a really good question, and I don't know if it's that we're better at diagnosing it and labeling it, or if there is actually an increase in incidence. Yes, so in my opinion, I think there is an increase in incidence.
Erica?
Sure, so I was just going to add on, through our youth risk behavior survey in Cuyahoga County, we've actually documented an increase in self-reported depressive symptoms at the population level in both middle school and high school youth. We'll actually be doing a larger event later this summer, particularly around adolescent depressive symptoms and mental health, and engaging an audience. I'm happy to share with this group as well.
And I just wanted to add on to your question. I can speak from experience because when I was first starting to quit, I was depressed, I had anxiety, and I couldn't focus in school. Those were all symptoms that, like, I thought, I wasn't sure what it was. I was like, am I not sleeping enough? I had no idea that the nicotine could be causing these symptoms. So, yeah, from experience, that does, yeah.
Speaking to the increased incidence of mental health instability, I feel like it's very hard to be a teenager today. There's literally a filtered existence, and that kind of negative self-talk that teenagers and pretty much everyone is prone to. It's just amplified by the fact that everyone only presents the best version of themselves, literally a filtered version, and it's just very, very hard to be a teenager these days.
By the way, you might have seen me take a picture of you guys while they were talking. My daughter texted me, she works at a restaurant downtown, and I was gonna pick her up to drive her home. And she said, I'm gonna take the bus, and I answered, good, don't vape. Which is essentially how I answer all of this. I don't know if it's working, but she heard me. Did you have questions, sir?
Yeah. Hi, I'm Andrew Rawl, a nurse practitioner resident at VA Primary Care. And I actually wanted to ask about marijuana, so I'm glad you brought it up. So I've kind of like two questions. One, mostly for Mark. I'm curious how much like this trend towards legalization and like how we're kind of leaning more into marijuana use in this country, has that influenced kind of your peers? And then do you notice that like vaping and marijuana use kind of have an interplay amongst your peers? And then to the rest of the panel, is this question of vaping taking away from maybe a more important question about marijuana use? And then clinically speaking, if I have a patient who's doing both, I see adults, but I think it's still relevant. You know, what should I have them prioritize one over the other? And how should that be approached?
Okay. Mark, let's start with you. Just basically the idea that there's legalization of marijuana for medical purposes. In some states, it's totally legal. Is that changing attitudes for young people, and is there a correlation of marijuana and vaping?
Well, now that marijuana is being legalized more, I'd say that the youth, they see it as less dangerous, and so there is a correlation between vaping and well, what they do is they take the THC oil and they vape that too. And some people they like to get high and then vape because they say that it increases the buzz that you get from vaping when you're high. So there definitely is a correlation.
And to the question about whether we ought to be concentrating on talking about the dangers of marijuana aside from the dangers of vaping, is our eye on a wrong target, I think, is part of the question. So who has a thought about that? Nobody. Okay, we'll move on.
So nicotine is responsible for almost 500,000 deaths annually in the United States. And so it more than AIDS-related car crashes, homicide, suicide, and drug and alcohol. They're like the top 6, yes, combined. So I think it's super important health-wise to get off the nicotine. On the other hand, it's illegal to partake in the THC here in Ohio. So there are risks to both. I think it's very empowering to have somebody not need any kind of kick to motivate themselves. But I think especially with when people are self-medicating for other disorders, I feel like it's going to be hard to convince them to stop. Just stop.
Erica?
Yeah. So I'll tell you, when we look at our kids, I'm going to respond about kids mostly on this, because I think it's really easy to say no child should be smoking anything of any kind, particularly because of brain development. In Cuyahoga County, again, we actually have more kids who are using marijuana currently than are using tobacco. So it is a and they tend to be similar kids. And currently right now we know that among kids who are using marijuana, they're smoking it in a blunt, in a cigar. They're taking out the tobacco that's also flavored and doing it that way. However, we are monitoring this closely because in Ohio, our legalization is for non-combustible medical use. That means we're going to see an increase in the oils in the market. And so we need to be aware, because as things become more available and easier for kids to get, they become easier to use, and then we see more use of them. And so this is something that we're very much aware of monitoring. And I think there are many of us in tobacco control who would like to see more of a conversation, and there's a growing conversation about the concurrent use of tobacco and marijuana, what that looks like in adolescents, and then what that looks like for adult users. But I would absolutely concur with Carly's comment. This is, tobacco, combustible tobacco itself is responsible for almost 500,000 deaths every year.
Jessica?
So I don't think the research is there yet, but what we are seeing sort of on the front lines with the teen population is daily the amount of marijuana vaping is increasing. And vaping marijuana makes you more likely to vape nicotine, and vaping nicotine makes you more likely to vape marijuana. I don't have the statistics. We don't have the statistics yet. Probably will get them. I could be wrong. I don't think I'm going to be. What we're seeing with our teen population is an increase in marijuana use. I mean, and I think the perception has changed with how dangerous it is and how socially acceptable it is and what kind of kid is using marijuana. And I think marijuana has started to shift in the teenage mind from there are drugs and then there's alcohol and nicotine over here. And marijuana's moving over here in their minds. The other thing that I always stress when I'm talking about adult populations in relation to marijuana use and teen populations is when I talk with the teenagers, I stress to them that it's two very different conversations. And if you want to talk about adults in utilizing marijuana in a medical way or adults who are utilizing it recreationally, we can have that conversation. We can talk about the research that exists, but it has nothing to do with teen use because of the brain. And we are seeing, I think the research supports this, and we are seeing this firsthand, that folks who are regularly using marijuana, we are seeing exacerbation of existing mental health symptoms for the teen population. And it may be very different at the adult population, but for teenagers, vaping marijuana is definitely a major issue, and with very real physical consequences as well as legal consequences. So it's definitely very present as part of the vaping issue, the vaping epidemic.
Carly?
When you talk about the growing brain, it is entirely accurate. A teenager's brain doesn't fully mature, and especially the frontal cortex, sort of the control panel of the brain.
Until like 53, 54.
For men, yes. Till somewhere around 25. And so when teenagers start to use these medications, specifically nicotine, it does sort of create an uptick in the incidence of use of other drugs of abuse later in life. So cocaine, heroin, and I don't see why marijuana would be any different.
All right, next question. Yes, ma'am.
My name is Jerry Tennant. I'm from Metro Health. I know that Erica knows a lot about tobacco regulation, and I'm wondering what's brewing about e-cigarette regulation. Is there anything on a state or national level that is coming up?
So what about regulation? What about e-cigarette regulation and what might be on the horizon? I know that there's been a push in Ohio, as there have been in other states, to raise the age to 21 for purchase. It's 18 currently, as I well know. What are your thoughts on that, and maybe to the question about what else on the national level or the state level might be on the horizon for regulation?
Sure.
Erica Trappel.
So nationally, the U.S. Food and Drug Administration Center for Tobacco Products is responsible for regulating tobacco products or tobacco products containing nicotine. The more recent conversation related to e-cigarettes has been around regulation of flavors. We talked about flavors a little bit earlier. The preponderance of evidence that was gathered to support the banning of flavors for cigarettes was specifically related to marketing and attracting youth. And so the argument has been this is the same, write the page on the same playbook. With the numbers that we're seeing among kids, this is something that we should consider. There are a lot of lobbyists in this conversation and a lot of angles. And it also brings up the point that if we restrict flavors in e-cigarettes, do we potentially push folks toward menthol cigarettes, as menthol is still an allowable flavor. So that's one of the more hotly debated areas of regulation that is most likely to have some traction in the near future. There is also large discussion around Tobacco 21 that could happen. That has been passed in Cleveland. I believe it's been passed in Euclid. I believe Lakewood has either passed or is on the cusp of passing. And there's currently discussion at the state level with discussion around how strong the language is, but certainly states are moving towards that as well. Notably, just this past week, San Francisco, I believe, banned e-cigarettes from the city. So there are different approaches to limiting access. But I think at the federal level, the most likely thing that we will see is limitations of flavor, but that will still be several years out.
Any other thoughts on that?
So the T21, the tobacco 21 that you were talking about, so there was a study in New Jersey that was sponsored by Harvard, and they were talking about that even in this one county, right? Isn't that how it's by city or by county?
Depends on the jurisdiction.
So the T21, meaning that you cannot purchase tobacco products unless you're at least 21 years old, it's huge because what happens is the kids who are getting these, like how do kids under 18, if it's legal for 18, how are they acquiring these devices? So they buy it off of someone in school, or they use a fake ID, or they get somebody to buy it for them at a little markup. But if it's, and then think about how your 11 or 12-year-old shares a bus with a 16 or 7-year-old. If you take it out of the realm of the school, away from the bleachers, the gym, the sporting events, the bus, just 21 and up. It doesn't need to be anywhere near the schools or the kids.
I'll just add on the regulation aspect, there are centers and universities across the country, which Eric and I both collaborate with different groups who are studying the question of flavors and e-cigarettes with the goal of providing evidence to inform the FDA so that they can make a policy and enforce that. And certainly there are differences in the various products. And one of the concerns that has been brought to the table is that as I mentioned earlier, the DIY approaches, and that, it's very easy to make flavors for, this is easier with vaping than it is with like cigarette flavors because you can't do that in the same way. But, kids can Google online and easily find really detailed instructions with well-produced videos showing how to make various flavors. So even if the government decides that those can't be sold, what would prevent someone from creating their own flavors?
All right, we need another audience question. I see an entire room full of smart people. Who shall I pick? Yes, ma'am. What do you have? Sure. Yeah. Okay, we won't do that. Let's get some. We're near the end of the. Okay, we do have a question.
Okay.
Yes. No, we got one right here, and then we'll. Listen, I only asked for one.
For one, Karen.
Yes, ma'am.
Kristen Hildreth, I'm with Medina County Health Department, and we are partnering with our juvenile court and our school systems because of the repeat offenses for Juuls versus tobacco. Now I use Juul as nicotine delivery product.
Sure.
What we're finding are when the parents get upset because they bought those Juuls, well, how can you confiscate it from my child? And in our juvenile court training, we have a class, and when we have the parents stay, there's an aha moment for those parents. Same thing. I bought this thinking it was better for them than cigarettes. I didn't realize that I was contributing to this. So there's kind of this interesting dynamic of talking to kids young, but this idea of working with the parents that this is not a better option for your kids. So there's that component of it that we're experiencing. Just a handful where they're like, oh my God, I didn't know I was doing this to my child. And that big aha of, what do I do now, kind of a thing.
Wow. It sounds like we have a lot of education of parents to do. But this isn't just, we've been talking about what we say to the kids, but it sounds like parents need to learn a lot here too.
I think it's really important that we as change makers in this room all shift our language away from when we're talking about vaping, smoking an e-cigarette, and let's just talk about nicotine addiction. Let's keep saying those words. I think we hear from parents when we're doing parent education very regularly. I did not know that it was as addictive as cigarettes. I did not know there was nicotine in there. I thought it was different. They said it was safer, so I thought that meant there wasn't nicotine. So if we can stress in our conversations, whether we're educating youngsters or parents or administrations at schools, the words nicotine and addiction, I think that carries a lot of weight with parents.
All right, we've got another question. Yes, sir?
Yes.
So, Donald, you want to go?
Sorry, Dan, you were sitting, so we'll get you next.
So a question for Dr. Wilbur. So we share a profession. We're both general pediatricians. We actually go to the same synagogue. So in the child-proofing literature, you can demonstrate that there's no efficacy for pediatricians to say, get child safety locks on the cabinets, get the poisons out of the cabinets, turn your water temperature down. If you go and do SHU under epidemiology, those kinds of statements in the context of a well child care exam have no impact on what actually goes on in houses. So they help us as pediatricians to feel like we've done something, but they actually change the environment very little. It's really enforcement and engineering that make the difference. So I'm going to ask you, because you have 15 or 20 minutes for a well childcare with a 14-year-old or a 15-year-old or a 16-year-old, where you've got to talk about immunizations, you've got to talk about sexuality and gender identity, you've got to talk about STDs, you've got to talk about pregnancy, you've got to talk about a lot of different things. Where does this fit in? Yeah, where does this fit in terms of the amount of available time? And why don't you just throw it over your shoulder and say, I can't do this, because it's not efficacious.
Well, I can't throw it over my shoulder, David, because I'm committed to, helping kids and all of that, same way you can. Where does it fit in? I won't lie, I do some profiling. Some kids I talk to more about these things, just like I do with, sexual activity, and you try and trust your gut when it comes to, is this a relevant conversation? But it should be relevant to everyone. And I sort of toss it into my safety talk, but it is brief. And then I get into it more once the parents leave the room and I say, so really, truly, are you doing this?
And that's from the doctor's side. I think from the parent side, we don't have a 15 or 20-minute appointment limit, so there's really no excuse not to be having those conversations.
It's awkward. Some parents
Awkward.
don't want to.
Oh yeah, I'm good at awkward. All right, we're gonna have a final question from Donald.
All right. So I know I'm old enough to make jokes about the Cuyahoga River, but when I was coming out of training, and even for several years of my practice, we were worried about oral use of nicotine and tobacco, the snooze and the snuff and stuff like that. Is that just no longer an issue, or is this, has vaping completely replaced this, or is this still something that we need to incorporate into our thought of youth and tobacco?
Sure. So I tend not to talk about it because here in Cuyahoga County it's not as much of an issue as combustible tobacco is. But certainly across the state of Ohio we still have a very significant, significantly high rate of smokeless tobacco. The risks to smokeless are much different than the risks to combustible. And my gut would lead me to think that I have no idea what the association between smokeless tobacco use and vaping or electronic delivery is. They have tended to be pretty different in some cases as far as use of those products. So it's very much an issue, but we see much less than Cuyahoga County. In our surrounding counties, absolutely, we see a bit more, I know, in Summit County, kind of in the southern part of Summit. And it's kind of a regional, so it tends, at least in our experience, to be more prominent in rural contexts.
I think for young people who are addicted to nicotine and their delivery system of choice is vaping, they're facing this issue of how do I get through the day, to how do I deal with my nicotine addiction through the day when I'm in a school setting. And so we're starting to see those young people that are addicted to nicotine exploring other nicotine delivery system options because they, are trying to figure out a way to do this where maybe it's not going to be as visible. One thing I've discussed with some of my 18-year-old students who are trying to quit is that cessation devices are approved and legal for you once you're 18, but you cannot bring Nicorette gum into school. You would have to give it to the nurse, and there would have to be a note, and it would have to be, given to you because Nicorette gum still has nicotine in it. And so I think we are still seeing with young people different nicotine products. So it's something to be aware of across the board for all of us and to educate parents about that. Even if you're not finding vape, if you're finding something else that is like, wait a minute, what is this? And little teeny tiny, they look almost like miniature tea bags, very small little packets, that like sort of single use. It's definitely something that's still a concern.
It's like a skull bandit.
Yeah.
Mm-hmm. All right, we're near the very end of this program, which has been terrific. What I'd like to try to do is, if you care to, let's take 30 seconds down the line for our takeaway from this conversation. Sort of, how would you, what message do you want to make sure that we convey? We'll start with Dr. Webb Hooper. Just put a little bow on it.
I thought you were going to start at that end.
No, I'm starting on this end.
That's what was left to say. I think take home for me is that vaping and e-cigarettes e-cigarettes are not safe, they're safer than smoking. I think it's probably pretty unrealistic to think that kids won't do it, much in the same way that if you have a conversation about sexual activity,